Hi, I'm Dave Fernald, the editor of Imaging Technology News Magazine. I'm here at RSNA 2015, and I wanted to have a discussion today about enterprise imaging and the transition to enterprise imaging with Kim Garriott. She's the principal consultant with Logicalis Inc., and with Jef Williams, who is the COO of Ascendian Healthcare. And I know that you guys are out and about on the show floor, and what are you seeing, and what are some of the trends, and what are some of the things that people need to know if they're going to go down the track of enterprise imaging?
Sure, yeah. So with enterprise imaging, some of the interesting technologies I think that we're seeing out here on the floor today are more of the vendors are focusing their products on enterprise imaging and how to enable streamlined workflows for image capture is something that's trending, I think, how you can capture mobile images on your smartphone devices, as well as be able to exchange images in and out of an organization smoothly and trying to get rid of those pesky CDs. So I think that as we walk around and we look and people are thinking about how to start an enterprise imaging strategy in their organization, it's really important to think about some considerations that really don't have anything to do with technology right out of the gate, right? So it's really being thoughtful about how you want to see these images after they have been acquired. How do you want to surface those in the EHR, and what kind of information you may need to accompany with those images so they can be surfaced intelligently in the EHR in a way that's going to be really relevant to the caregiver. So I think just for everyone to keep in mind as you start this journey, step back, take a breath, and be thoughtful about the workflows that you're going to use, the data that you want to acquire, and at the end of the day, how you want to enable the caregivers with a different level of information than they haven't had available in the EHR.
And how about the people getting involved with that process? Obviously, you have stakeholders. Should you include just radiology? Should you include everybody across the board with your different ologies, with orthopedics, oncology, cardiology? And then also, what about departments like dermatology or the
Sure.
ER?
Yeah, so when you think about establishing your strategy, you really need to think about governance and who is going to be involved in that. And it's really specific to each organization what works best culturally and politically within that organization. But personally, I think that the best governance strategy is one that's multidisciplinary, right? Obviously, you need to have your heavy image producing service lines at the table. They're going to be the drivers, right? So radiology, cardiology, but then also, as you mentioned, start to think about those image producers that are in the dermatology areas, surgical services, those individuals that may be heavily reliant on point of care ultrasound, like your emergency medicine physicians. So really look at it from a multidisciplinary perspective, and you'll have a really strong strategy and governance right out of the gate.
And Jef, can you talk a little bit about workflow and how enterprise imaging is supposed to work, ideally?
Yeah, so the word enterprise is an important component when we talk about this, and what I mean by that is, you can't solve an enterprise problem with a departmental solution, and you can't solve a departmental problem with an enterprise solution. We have been doing departmental rollouts for a lot of years in radiology. We've gotten really good at the technology, but this is a different animal completely. And so we have to think of it as a multi-tiered initiative. You've got an enterprise approach of how we're going to manage data across all these ologies, how we're going to ingest that data, how we're going to manage it, how we're going to display it, archive it, etc., distribute it long term outside of the our affiliated providers. And so there's a lot of considerations around this. In addition, when we were doing these for the last 15, 20 years in radiology, we really focused on workflow, but we didn't have to worry about data flow. And so the other part I'm seeing is that there's a multi approach to how we have to parse that out as well in this, because we had PACS. Data went in, and then it went out. And we didn't have to worry about integrity of the data because it was managed within this black box that we called PACS. And so it's critical that we separate those now, because the workflow is only going to have the integrity and the accuracy and the kinds of outcomes in the patient care we require if the data matches that. And so, we don't just have one vendor now. We have multiple vendors in this stack that we're rolling out across this enterprise, and we need to understand how the workflow is developed and organized around not just imaging but the enterprise content management. That's critical. and we'll continue to focus on that with our clinical folks. But at the same time, we've got to really integrate our IT people into that process, because now we have multiple systems managing similar data sets or duplicate data sets. And it can be really easy to skip a step and realize that we have disparity in our data. And as soon as you lose trust in the data as a clinician, you're dead. And so there's a lot of upfront work that has to take place, and the devil ultimately is in the details. We can't just roll this stuff out and say we're going to fix it as we iterate through the adoption process, because as soon as we get the data wrong, we've made a blunder that we will never recover from. So we've got to bring the right people to the table and ensure that we have it organized around our workflow, ensure that the systems support that, and that the data is always relevant and accurate and in sync. And that's not as easy as it sounds.
Right.
So from a overview, 40,000 foot view, enterprise imaging, as I understand it, is really taking everything across the clinical enterprise and looking at it in terms of ones and zeros. It's data. It doesn't matter whether it's a report, it doesn't matter whether it's a waveform or a CT data set or an echo data set. It's ones and zeros. And the transition of management's really moving away from radiology towards a centralized vendor-neutral archive, if you will, or a central storage facility, to where all your departments can dump and then retrieve information using content information retrieval systems. What do you think the best method of approaching that is? I've seen where hospitals have taken their Cerner or their Epic systems and used the EMR as their central database, and then they've plugged in ancillary systems from the other ologies and the specialty departments to be able to build out a complete electronic medical record. And I've also heard of other facilities using a VNA as a central repository, and then having a content management system laying on top of that with the different ologies coming in. What do you suggest, and what have you seen out in the field?
Yeah, so I have a personal preference on this, right? Coming from an IT background and being familiar with the challenges of managing multiple systems and multiple interfaces, right? And then also coming from a clinical perspective of what's going to be the cleanest and easiest way for caregivers to find information and view information, right? So kind of twofold. One, I'm a fan of having a centralized repository, as in a vendor-neutral archive, within a workflow management layer on top of that, or an ECM layer on top of that, to enable one single level of integration back to the EHR using one viewer for the images. Now, this is non-diagnostic referential viewing, right? We're not talking about our specialty diagnostic viewers, but one universal viewer that's embedded in the EHR, so that from an integration or an IT management perspective, I've really streamlined the number of interfaces that I have to manage and I have to test whenever I do system upgrades and other things like that. So I've taken a level of complexity out of there. From a clinical user perspective, being able to look at any image, regardless of the acquisition source, from one single viewer, and being able to display different types of images side by side, like a digital photo of the hand and then the x-ray of the hand. I'm only able to do that if I can see all my images in one single viewer, right? And then also from a caregiver perspective, I know I only have to learn to use one application viewer, right? I'm not forced to learn a viewer for cardiology imaging and a viewer for radiology imaging and a viewer for this and a viewer for that. So I think all around it's a big win to go with one level of integration from one centralized system into your EHR.
Last year at RSNA, there's a lot of discussion about deconstructing PACS, and the idea being that you can take the best of all possible breeds of your PACS, your cardiology, CVIS, and say, I want this vendor to provide this component, I want this vendor to provide this, I want this vendor to provide my DICOM list, I'd like this vendor to provide my viewer, but I'm going to go to this vendor and they're going to provide the content management system, the VNA that I need. Is that a model that you advocate, or do you think that is asking for trouble because of the multiple connections involved?
Sure. Both. Deconstructed, the terminology we use in this industry sometimes is a head scratcher to me. Sometimes I feel like we're more about trying to make technology statements than solve problems. To me, when I think about deconstructed PACS, what I'm thinking about is, my opinion of what we should be trying to pursue is standards-based ecosystems that solve problems for healthcare providers. and that's creating data, that's accessing the data, that's visualizing the data. How do we do it? Well, it depends on who you are, and it depends on who you want to be. I think that we've seen the explosion out into the deconstructed model, and then we're seeing them all kind of suck back in again. Are we going to end up with 10 vendors in the space that have modularized options and offerings? I think that's probably where we're headed. Is there value in having multiple vendors? Sure, as long as that makes sense for you and you have the maturity in your IT department, like you said, to be able to manage multiple service level agreements or create an integrated service level agreement. If you're a small shop, do you really want to be dealing with multiple vendors and trying to chase them down when you have problems and managing the upgrade maps of each of them? Because every time one of them does an upgrade, you got to test. So there's a lot of complexity there, and if you don't have the kind of shop that can manage that, I think you're taking on more than you probably should. So it's not an either or, it's a both and. And really, to me, I think it depends on, again, your size, your complexity, your maturity as an organization.
And then from an EMR perspective, the simple easy button to press might be just to go to Cerner or Epic and say, you know what, we already have you for an install of 3 of our hospitals, why don't we just build it out across the enterprise and you can just provide everything. And then having these disparate systems that we have to try to somehow patch in, it would be a lot easier just to have one provider for everything. However, in the real world, it doesn't always work out that way. I've heard complaints about some of the large EMR vendors and their specialty systems not providing everything that is really needed in those departments. There's one EHR vendor a couple of years ago that presented here and were showing their interface with radiology, and they had the images backwards on the screens and stuff like that. So, which might go to say maybe they have a little bit further to go. Right. But they are catching up, and their modules are becoming better. So where does that leave CVIS and PACS today?
So that's a great question, and I think with the exception of just a small handful of EHR vendors, we're really not seeing them move into an area where they're really tackling the provision of a PACS application to the end user. They may be looking, and they do of course support the radiology information system that would go on the front end of that for order management, patient flow management, things like that. But when you get into really the image viewing and the image manipulation, we're really not seeing a move with the industry as a whole looking at EHR vendors really getting into that.
Yeah, it's the only thing I would add to that is we're trying to develop some interfaces into the EHR and the EMR that are going to allow for some of the data that is wrapped around imaging that needs to be there. Because I think that's been one of the complex things that we've been trying to face. Are we we're feeding data into our imaging systems out of the EHR, and with the large EHR systems. Some of that data's got to come back. We've got things going like the fire initiative and different things that I think are going to help. But I think as long as we keep driving accountability towards the standards-based systems and integrations, we're going to get to where we need to go. But it's going to take a little bit of time. And there's going to continue to be, I think, some real challenges. And everywhere you go, they're going to be doing it a little bit differently, which is always tough because now you got to support it, and you're the one of a kind. You know. I know you've probably experienced that a little bit at Cleveland Clinic because you guys have a huge ecosystem. And you were there for a lot of years. Yeah.
And I mean, it's nice to try to keep everything in one single source, but I do think that imaging is technologically very unique, right? And I think that imaging has been at the forefront of technology in healthcare, and I think in many ways we're still in the forefront of technology, and systems like the EHR aren't necessarily there yet. And I actually think it's wise of the EHR vendors in a lot of instances to let those technology companies that understand imaging the best to manage imaging and provide those imaging solutions, at least today, where we're at today.
I think a lot of the providers I've talked to would probably agree with that as well. So I wanted to thank you both for coming out today and offering your insights. It sounds like there's a lot of moving parts and maybe reason for having a consultant. So
Thank you.
Thanks,
Dave.